So how do you think your boss would respond to you sleeping on the job? This next story is about a D.C. man who says people he relies on to keep him safe throughout the night often fall asleep, putting him at risk. They're nurses and aides provided by the district with your tax dollars. As Tracy Wilkins and the News 4i team found out, advocates are raising the alarm about this growing risk they say is impacting some of the most vulnerable in our city.
Damon Brooks knows the value of a good team.
I don't like no typos, no misinformation.
As a writer for the Monumental Sports Network, he makes his living covering athletes.
I write about local colleges, high schools, and local professional teams.
And that team mentality is even more important for Damon off the job at home.
So, Damon, it's very clear to me that you are a go-getter, that you're going to meet your goals, but you still need help.
Absolutely.
13 years ago, a tragic wrestling accident with a friend left him a paraplegic. He depends on nurses and aides throughout the day, managed through a city program funded by Medicaid. It allows him to remain in his own home.
Your morning nurse is fantastic.
She's outstanding. We'd have no problems at all. She's like a mother to me. I love her to death.
Helping him with everyday tasks, checking his vitals, getting him ready for work, then for bed. A different team is supposed to monitor him overnight. That's when he says things get harder.
Every night since, I've unfortunately had this accident, I've had employees sleeping, snoring on the job, neglecting me. Sometimes I've been left sitting in wet chucks. Sometimes I've been, just neglected to use the bathroom, and it's been very difficult for me.
It's become such an issue, he's installed cameras around his apartment in plain sight. He says he's collected hours of employees appearing to sleep through the night.
They're supposed to be repositioning me, catheterizing me on time. They're not supposed to be sleeping and snoring, and they're supposed to be attentive to my needs, but sadly that hasn't been the case.
He says he's complained for years.
I've sent pictures, I've sent emails to the nursing agency, the deputy mayor, council members. I've done multiple things to try to get assistance.
But says the problem has only gotten worse.
If there was an emergency in this apartment overnight, do you think you'd be taken care of?
Truthfully, I don't know.
He says in the last few weeks, he's had nurses and aides simply not show up for the overnight shift, leaving his mom to help him.
I won't lie, I've cried several nights. I've cried multiple mornings. It's a very depressing situation.
Advocates have raised concerns, too, about sleeping on the job earlier this year at a D.C. Council roundtable discussion on long-term care.
It is a very serious problem of aides showing up with no intention to work. Many of my clients report and have photos of aides arriving for the overnight shift, midnight to 8 a.m., with blankets, pillows, hair rollers, clearly intending to sleep.
Attorney Holly Eaton says because of a shortage of aides or PCAs, home health agencies allow their employees to avoid what they consider more difficult cases because they worry they'll quit.
If the beneficiary is able to articulate his needs, ask for assistance, and oversee what the PCAs are doing, the aides do not want to return to that job because they object to being told what to do and don't like being watched.
If you sign up for in the night shift, you go to sleep during the day. We all make sacrifices day in and day out. Just because it's a night shift doesn't mean you have the ability or the right to sleep.
A spokesperson for the Department of Healthcare Finance, which oversees the program for the city, told the I-Team, DHCF expects that all nurses or personal care aides are consistently available to deliver services as needed, safely and appropriately as needed, and in accordance with a Medicaid beneficiary's plan of care.
They have the ultimate oversight and sanctioning and enforcement authority.
Mark Miller with the Office of the D.C. Long-Term Care Ombudsman says the Department of Healthcare Finance can and should do more. He says every time one of these overnight aides closes their eyes, they are essentially stealing from taxpayers.
You're taking taxpayer dollars and not providing the service that you've contracted to provide. And there's really no other way to capture that. I mean, we would look at that as fraud. We also would look at that as potential neglect or abuse.
How big is this problem?
It's hard to know because I think some of it is unreported. Some people, like I said, do not want to kind of rock the boat because they're afraid then they won't get any aides in the evening or on weekends.
Damon doesn't have that fear and has complained to his case manager, the city, and nursing agencies.
How many night nurses do you think you've been through?
Over 40 with this particular agency.
He worries his reputation for accountability is scaring the help he needs away, but he says his fight is about more than himself.
I'm just really worried about, others, because if the others are subjected to this, that means we may have casualties, and that's something I really want to prevent from occurring.
We did ask DHCF about any steps it's taken to address the sleeping complaints, and also reached out to the various agencies that have provided aids to Damon. We did not hear back. We did find a sleeping complaint filed back in 2023 with one agency Damon has used. In that report, the agency said it retrained the employees on its sleeping policy and gave them a verbal warning. But at the end of the day, what advocates are saying is that tax dollars are being used to pay for this service. They're expecting that service to happen.
It's such a difficult position because people, we know it's a tough job, tough hours, but they're required to perhaps save someone's life in the middle of the night.
And that's the worry, especially for folks who are nonverbal
Right.
and can't communicate that something is happening. And that's what Damon is concerned about. Advocates we talk to say there needs to be more follow-up after someone makes a complaint, but also there needs to be more discussion to address the shortage crisis, incentives for nurses and aides to work overnight and weekend shifts, like getting overtime. These are tough shifts, and we know some of the aides are likely working multiple jobs to make ends meet. But as we were saying earlier, if there's one job they need to be awake for, it is this one, because you never know what can happen. He was setting
Absolutely.
alarms for some of these nurses to wake them up, and it may or may not work. So just imagine if a machine had gone off or something had happened, and he didn't get the help he needed.
Yeah, and to his point, it's not just about him. There's so many other people who require this kind of
Absolutely.
aid. All right.